My passion is the heart, and I spend most of my time working on people's hearts, literally, but not as much as I desire to figuratively. And the heart, which is our most poetic of all organs, we have bleeding hearts and cold hearts and stone hearts, and it goes on ad nauseum. But it is the aspect of the patient I think we deal with least effectively when folks enter into the medical center. So I've spent a good part of my life trying to figure out how do we address that. And I'm coming to the realization that what we have to do is create a smart patient movement. I think the way to reform medicine is to have a group of smart patients, maybe it's 10% of the population, they're caregivers, overwhelmingly, which means they're women. They take care of their sons, their husbands, their fathers. They're the ones that are going to drive this change. And for it to happen effectively, we have to empower them. We need to give them the toolkits they need. And then we have to make medicine responsive to it. And I'm convinced that we can actually make that happen. I would plead with all involved in this process that we look for logistically achievable solutions. But taking them into Beth Israel or any other major medical center and getting them to work is difficult because we often don't translate the information effectively. I think we have to think of ourselves as translators who can take information that we know in our core to be so important, so soulful, so authentic, and so valuable to the process, and allow folks who are working as hard as they can to take care of patients and not getting the goals that we desire.